All right, hello and welcome back to Channel One TV for Sunday breakfast with me, Jude Duncan, and my co-host, my co-pilot, Eno Safo. Just gone by a melodious moment of worship, really, because of course today's a Sunday and we have to give God his due. So we did exactly that. Just before that, we also had a newspaper review where we recap on the big news stories of the day. If you're wondering how you could be a part of this exciting program going on your television, you can do so by using the hashtag Sunday Breakfast on all social media platforms and even X, of course. Yes, so use the hashtag Sunday Breakfast. Send in all of your messages, your comments, your questions, anything. In fact, if you think Eno is looking lovely as she is, and I think send in all of those messages, I'll be glad to read it across for you. The WhatsApp line is 0200 447 033. Send a message, send a comment. I'll be glad to read it across so the whole of the world can get your thoughts. Charlie, so far an hour has gone by quickly already.
I'm having so much fun. I don't even want it to end.
I feel you. You know the thing they say about aura? Aura, Charlie. Guy with your aura.
Yeah.
Yeah, it was the same thing when our guest walked in. I felt, because like I wanted to say something, but I'm not sure whether I was starstruck or what, but there was some aura around the person. All right, listeners and viewers, of course. So we are delving straight into our next segment where we discuss very important things that you need to know about your own being, right? So doing this discussion with us, no other person, lovely lady, Dr. Kalsum Zakaria Adam. I mean, it's incredible having you. I think the first time I saw you, met you, was on the Akosombo Dam Spillage outreach.
Oh,
and my, oh my, the energy, the verve, the enthusiasm with she and the team had on that outreach, amazing stuff. Doc, welcome.
Thank you. Thank you for having me.
It's a pleasure having you.
Great.
Today we are discussing neck and head infections.
Yeah, head and neck infections, spreading head and neck infections.
That sounds like a lot is going on. Yeah. Can you just give us a brief overview when we talk about head and neck infections? What really are you referring to?
Okay, so I would start with the fact that head and neck infections. So when you have an infection is usually when you have a microbacterium inoculated in a particular space within your body, and then it multiplies to certain levels such that it now begins to cause harm to you as an individual. Okay, so that's basic definition of an infection. So when we say head and neck spreading infections, it means that there's some bacteria or inoculation of bacteria at a certain site within the head and neck region, and then this infection starts to spread to other distant areas through fascial planes. So when you take the head and neck region, you have different spaces. Okay, so you have the anterior triangles of the neck, you have your jaws, which house your teeth, okay, and then you have other areas within the neck, your posterior triangle and all of that. And you see the neck has very vital structures. You have the great vessels there, you have your trachea, you have your larynx. So your trachea and your larynx are part of your apparatus for breathing.
I remember my letter integrated science.
Exactly.
Yeah.
You know, and then you have your esophagus also starts from the neck region, from the mouth all the way neck region, and then it goes. And then within the mouth, you have your tongue, you have your teeth, you have the upper, your palate, and then you have other structures in there, you know. But then when you have an infection, a focus of infection, usually 90% of it is from the mouth, okay, from common caca. Or dental caries, okay, which has not been treated over a long period of time.
Whoa.
So people tend to ignore it. Oh, I have a little toothache here. Then they tend to ignore it. They don't have it treated surgically as it's supposed to be. They tend to do sometimes herbal medications, which will make it even worse. Or they tend to end up using. Sometimes it will amaze you the kind of things people
The kind
do.
of local remedies
Exactly.
people are concocting in the house.
Car battery.
Are you kidding me?
Some people get car batteries and then actually pour through the area where the curious lesion is located.
Incredible.
So, you know, the car battery will numb the pain a little bit. So they feel that, oh, the pain is gone. Then they continue with their day-to-day activities, not knowing that the body or the microbacterium is increasingly multiplying. And before they could say Jack, they would have started having what? A swelling, a small swelling. And you know, as we have a small swelling, they will say, oh, exactly. So as we have a small swelling, then they will say, oh, it's just a small pom-pom or something.
Yeah.
Let me just start applying some topical herbal medication on it. Before you notice, it is spreading, and it spreads all the way through the neck to the chest, to even where your heart is.
And that could be
And that is
fatal.
very, very
Interesting.
fatal.
When this topic came up for discussion, right, I was thinking around maybe experiencing a whiplash, right? Maybe in a vehicle, then the impact is so hard in the crash where then your back of your neck and your head area begins to ache like a migraine kind of level. But I didn't know it was this serious and this intense. So you talk to me about how other parts of your body can be affected when you begin getting these infections.
Okay, so what happens is that I would want to start with the causes or the etiologies. And as I said, 90% of it is odontogenic or is coming from a toothache, simple toothache.
90%?
Yes, chronic toothache that hasn't been treated. Then there are other things that can also cause these spreading head and neck infections, like having a tonsillitis or peritonsillar abscess. So when you look at when you open your mouth and you look at the back of your mouth, you notice that there are these tonsils or there are these small bumps, two small bumps at the back of your throat. Okay, yes. So sometimes when it gets infected, that can also track down to these fascial spaces that will give you the infection that we see. Another could be that when you have infection of the supporting structures of the teeth. So when I say supporting structures of the teeth, I mean the bone itself. There's something we call the periodontal ligament. And then periodontal ligament. Exactly. And then the gums as well. Okay, so when they are infected, that can also lead to this spreading infection. And then when you look just beneath your jawbone here, you have something we call salivary gland. And the salivary gland is a gland that helps you. Anytime you talk, you produce saliva.
I feel you.
And then it moisturizes your mouth. It helps you to swallow. It helps you to eat properly. It helps you to taste food and all of that. So when you have stones, sometimes stones forming within the salivary gland, it can also form a focus of infection that can lead to the spreading infections.
Wow.
So all of these are some of the causes of spreading infections within the head and neck region. Now, what are some of the signs and symptoms that these patients will present with? Usually, when you look at the picture in the screen, you notice that there's, where the arrows are showing, you have this, it looks like...
The pus.
Exactly, like a purulent...
Okay, so
while Doc is going to show us that, remember to...
Right here, I believe, right?
Yes.
The yellowish thick substance.
Exactly. So you can see this pus-like yellowish discharge. Okay, so we will call it a purulent discharge. And usually this would qualify to be in the submandibular region.
The
submandibular region. So your lower jaw is called the mandible.
Oh, okay.
So sub means just below the mandible. You see?
That is basically
all right.
You can follow.
And you can see that, you see, there are reddened areas around it, showing that it's an active process that is going on. And you should also look here. You notice that the mouth is full. So when your tongue the infection or the pus has filled below, when you say submandibular, it's below the tongue. It has filled that area.
Yeah.
You notice that the tongue moves upwards and blocks the airway. So you can't even breathe.
That's crazy.
You can't even breathe. So they actually come in very critical situations where they have to quickly be resuscitated, otherwise they lose their lives.
Wow.
So you can see in this picture, she has 2 prongs within to help her breathe properly. So you are put on oxygen, and then what happens is that you quickly assess properly, and then you would have to surgically drain this abscess.
I feel you.
Yes.
Doc, my next question to you is, considering the fact that it affects almost every part of your head region all the way to your neck, will you say people who are predisposed to maybe sinuses, complications, are at a greater risk of having some of these infections?
Well, the sinuses are air-filled spaces within the head region. And we have about 4 of them. The common one you would want to see is the ones that are here. We call them the maxillary sinuses. And if you often get cold, do you get it? That's sometimes you notice that there'll be a discharge within the sinus. But the sinus is, when you have an odontogenic infection, it can lead to sinusitis. We call it acute rhinosinusitis.
People start rubbing their nose.
Exactly.
All of those things when they start feeling.
So that is another form of infection. You get it. But then for this, usually, even if you have the source of infection being from the upper jaw, where the teeth are, it can spread to areas within the face, that is around the eye. So you notice that the eye will be shut. Or it can even go all the way to the brain. So we call it intracranial spread. Okay, so that's when you would have spread
to do with the bone,
brain.
The brain.
Okay, so it can go into the brain and you end up having an infection within the brain region. Or if it goes down, like we see in this patient. So this typical presentation, we call it, it's a big word. We call it Ludwig's angina.
No. I'm not going to attempt, but you can repeat it again so we have an idea.
So we call it Ludwig's angina. So Ludwig's angina, where you have the sublingual space, the submental space, and the bilateral submandibular spaces, all filled with the pus, such that the patient has difficulty breathing, and then difficulty even swallowing anything. So, you have to be, day in and day out, you swallow your saliva.
Yeah.
But in these patients, because of the dysphagia or the difficulty in swallowing, they tend to be drooling. So you see saliva drooling out of their mouths. You get it. So the presentation is quite very, very, we consider it as an emergency. And it's sad because infections at this stage of our lives, shouldn't get us to levels where we can even lose our lives.
Absolutely.
Yes, so a lot of people do not know about it. A lot of people tend to trivialize toothaches when they have them.
Yeah.
So the whole import of this is to let people know that it's important that once you have, since 90% of it is caused by toothache, if you do have toothache, please have it treated.
Talking about getting it checked, I'll come to you on data if you have it on the number of cases and the occurrence rate and all of that. But I also wanted to ask you about the formation period of it. When, like you said, when some of them start with a toothache, about 90% of it. I see people say, take an antibiotic, take a painkiller. Is that a way to go about with regards to treatment?
No. So the treatment, let me just go a little into the basics. So when you take a cross-section of a tooth, it has 3 different layers. There's an outer layer, where when we all smile, you see it.
Yeah.
Okay? Is usually the hard layer. We call it the enamel. Then you come to a second layer, which is called the dentine, which is a little it's not as strong as the enamel. Then you have the third layer, which is the pulp. That is where your blood vessels and your nerves that give sensation to the tooth are located. Now, when an infection starts, it starts from outward. So it would affect the first layer, which is the hard layer, which is the enamel. Usually that is painless. So most people do not come to the hospital. You know, as Ghanaians, we want to feel some pain before we think that, there's something.
See some small shaking.
Exactly.
Let me not keep you standing too much. You could take your seat. Let's have this conversation. People want to feel some
pain,
slight shake
before they feel I mean, there's something wrong happening. So usually you don't get people coming in that stage. Then when it gets to the dentine, that is where you have some sensitivity or hypersensitive states, where anytime you take in some cold foods or warm foods, you tend to have this short, sharp pain. Yeah. Okay, like an electric-like shock pain. Okay, and then it can progress to the third layer. And the third layer is the soft part of the tooth that goes all the way, and then it's actually is related to the bone. Then it can go past the bone, go to other fascial spaces within the neck, and then it can go all the way to your chest, and then the mediastinum, where your heart is located.
And when it gets there, life and death.
Yes, it's a life and death situation.
Wow.
So there are times that people come in, and when they come in, the first thing you would have to do is to quickly triage them and be sure where they are. Are they very critically ill? And then you start, and usually because it has been long-standing, they haven't been eating, they haven't been drinking, so they come in very dehydrated, they come in very cachectic, they have lost a lot of nutrients already. And you know, eating alone is an immune booster. It helps you fight infection. But here's the case: you have an infection, and then the second thing too is that you haven't been eating for a long time because of the situation of the infection. So it is very, very critical for us. As soon as they come in, you need to run some of your investigations from your labs. You do some lab investigations to check their blood levels. You do some lab investigations to help you check their protein levels. And then you check their chest as well. So you take a chest X-ray and then you see. And many a times, most of the cases that we see, you tend to see that the pus that we saw, or the Puritan discharge, would have tracked all the way through the mediastinum, where your heart is, to the lungs.
Wow.
It has filled the lungs.
Incredible stuff. I'm feeling some things going on in between within me already.
Yes. It would have filled the lungs.
The very graphic and detailed description you are giving us. Like I said, I want you to talk us through the prevalence rate, right?
Yes.
How common is it, or otherwise within
From
us?
some of our papers that we have published, it is quite common. It's about 35 to about 45%.
35 to about 45%. So 3 to 4
of
people
the complications
out of every 10 people.
Exactly.
That's
end up
serious.
coming. And you see, because we have a lot of over-the-counter analgesics, like some diclo, so people, when they feel the pain, they quickly run to the
over-the-counter and over the trotro. Because you sit in we were discussing the other time, you sit in a public transport, right?
And somebody is
commercial
talking.
bus, and one medication
can solve like 7
Are
problems.
you kidding me? And that is supposed to solve head and neck infection, solve piles, solve
even eye conditions, everything.
Are you kidding me?
Everything.
I think it's about time we began having these conversations. I think the FDA, the Standards Authority, they are trying, but I think we need to put a lot more effort.
I think we need to let people know about it. We need to let people know that as soon as you start feeling any of these signs, please don't let it get to the stage where you would be fighting for your life.
At what stage will you say it's too late to probably seek? I'm sure you guys are there willing to take them at any point in time. But at what point will you say don't negotiate on the timing, go straight into the hospital?
I would say the moment you feel any pain.
The moment?
Yes, and don't even wait to feel pain. If you feel that you have an odontogenic infection, quickly run to the hospital and let it get checked. If it's checked at that moment, as I said, there are 3 different layers. The moment we pick it, if it's on the first layer, second layer, it can be treated without having to go through all of these complications that come with odontogenic infections.
Wow.
So the moment you feel that there's a hole, or the moment you feel that you feel a little funny in your throat, or any of these little signs and symptoms that I have mentioned throughout our discussion, quickly run to the hospital and let it get checked.
Very important.
Otherwise, it may end up affecting your airway. It may end up affecting the area that you usually use when you are swallowing, and it may be too late for us to intervene.
Interesting. I'll come back to you on ways we can, things we can do to safeguard ourselves from contracting this virus. But I went to a boys' school, right? I went to Accra Academy.
Okay.
And for most parts, right, all through my stay in the boarding house, you see somebody using the same toothbrush the very day he entered the school up until the end of the academic year.
Yeah.
Is that a cause for concern?
Yeah, it is. It is. Usually, it's recommended that you change your toothbrush every 3 months.
Every 3 months?
Yes, and for adults, the toothbrush that you use, I'm sure a lot of us are guilty.
Can you hear the laugh in the studio?
The kind of
Exactly.
response this elicited from the camera crew is
I'm
enough
worried.
reason for you to rehash on it
I think
again.
we need to tell someone to buy us toothbrushes.
Every 3 months.
Wow.
Yes, you should change. It's recommended by FDA that you change your toothbrush.
Every 3 months.
Every 3 months. And for the standard toothbrush to use for an adult is the medium bristle type. So when you look at the packaging of the toothbrushes, we have a mild bristle, we have a soft bristle, we have a medium bristle, and then the hard one. Usually the hard ones are not recommended. The soft ones are for kids, and then the medium ones for adults. And it should be every 3 months you have to change that. The reason is that if you continuously use it for over 3 months, it tends to harbor some of the bacteria within it. And then that can be deposited in the process of your cleaning.
I feel.
Yes, so it has to be changed every 3 months.
I see people also use some sort of strong, like something like Dettol and stuff to clean their toothbrushes. Is it recommended?
No.
I've seen it a couple of
It's
times.
regular water.
Hot water.
Yeah, not even hot water. Regular room temperature water. That is what you have to use. Make sure that after brushing, you wash and make sure all the dentifrice that you used is out of the brush. And then you keep it standing so that air could pass through and then dissipates if there are any remnant microbacterium in there. Yes.
Interesting. Now talk to us about what we can do so we don't end up like the picture that we saw on the screen. Very importantly, because you mentioned that the prevalence rate somewhere around 35 to 40. That's quite high if you ask me. So what should we do? What should we be seen doing to not be part of that statistic?
Okay, so as you mentioned rightly, oral hygiene, since 90% is from the mouth, oral hygiene is very important. So your regular brushing morning and evening, you should take it seriously. Change your toothbrushes as you have to do every 3 months. And then floss in between your teeth as well. It's also important because it's able to, the flosser is able to go in between the interdental spaces and then remove any plaque which has a lot of bacteria in there so that you reduce the bacterial load within the mouth. Another is that any time you feel that there is some pain or there's some hole within your tooth, you quickly visit the hospital and have it checked so that is done for you. I mean, it is assessed and then duly treated. And let's stop going to over-the-counter and then get some medications. Usually, it is the NSAIDs that we are served with. And NSAIDs have other dire consequences on our health. So aside, can you imagine, aside all of these, some come in and then they end up with what's PUD. We call it peptic ulcer disease. So peptic ulcer disease, because of the chronic use of the NSAIDs, it goes into the stomach, and then it causes what? Ulcers within the stomach. And then that can also, so assuming you have such a patient that you are fighting to drain all of this pus and then help the patient transition nicely into health. And you have to manage other complications like a perforated peptic ulcer, where that also has to be managed surgically, where you have to open the abdomen and then locate where the leakage is. And then, so you see all the complications that come with, I mean, indiscriminate use of all of these NSAIDs.
I feel you.
Yes, so because of the toothache, people don't, I mean, they are in pain, they still want to manage conservatively. They go and then they usually would be dished out with some of these NSAIDs. They take them without any precautions. And then that is also causing, even though it gives them relief to the oral pain, but it is causing a lot of harm in their stomachs. And then that can lead to a perforation, which also comes with its own side effects.
Doc, I mean, thank you so much for this vivid and very detailed lecture. I'm saying medicine 101 to begin with, walking to the screen, helping us understand the issues. I didn't think it was as serious, but I mean, walking us through, giving me different perspectives now. So grateful for your time.
Most
so grateful
welcome.
that you could join us
for
this really elaborate public education, free public education.
Free,
I know, right?
free.
Thank you so much, Doc.
Thank you too for having me, and I hope it was
super
educative
enough. Perfect.
We've learned a lot. So do change your brushes every 3 months. It's not if you can, it's a requirement just to make sure that you keep your teeth clean.